Welcome everybody to the training on the simple sinus lift formula. My name is Dr. Ziv Simon. I'm a periodontist and an implant specialist practicing in Beverly Hills, California. I've been in practice close to 25 years. I've been an educator about the same time. I'm double boarded, and I'm excited for so many doctors to join us today to learn a very simple technique to lift the sinus and build your implant opportunity so you can place more implants, so you can restore more implants, so you can offer more to your patients, so you can build your reputation and grow your practice with a simple procedure that every general dentist can perform if they know the formula and if they do it safely. So again, welcome to this training today. The sinus lift formula starts with extractions of upper molars. Most upper molars, once you extract them, over 90% will require some type of sinus lifting. It's just a reality. And if you don't know how to sinus lift, you will either leave it as a space, not good. You'll recommend a 3-unit bridge or refer the patient out, and you know this patient needs an implant because that's the best option to replace a missing tooth. So if you know how to sinus lift and you know this simple formula, you'll be able to help this patient. And what you need to know is how to do it in a predictable way, in a safe way, in a clear way. And that's my job tonight, to share with you how we do these types of lifts for 90% of all cases. How do we do these lifts which allow us to place more implants, which allow us to restore more implants? It's almost doubling the amount of implants that we can do, that allow us to offer more procedures to our patients, that allow us to grow our practice, build our reputation by doing sinus lifts. And sinus lifting is one part of bone augmentation procedures that you can learn, and we teach this in our platform, in our advanced courses, of course. So this is your implant opportunity. If you don't know how to sinus lift, you'll do less implants. You'll restore less implants. If you know how to sinus lift, you'll do way more. And it's so exciting to create something from nothing. This is just almost like magic, but it's not magic. It's biology, it's technique, and it's a formula that I summarized for you in this training. Now, you're going to have failing bridges. Bridges ultimately fail. What are we going to do? The abutment teeth can break and fracture, and then the patient will need 2 implants or more implants. And you need to do sinus lifting to follow this opportunity. And I personally, in my own practice, I obviously, as a specialist, I do a lot of sinus lifting and other augmentation procedures. And the way I perform them in my practice, and I treat some of the most demanding patients in the world, some of the most pickiest patients. I can't afford to make mistakes or have too many complications. I do have some. The way I perform sinus lifts in my practice, it's exactly how I'm going to teach you how to perform them as well. Because for myself, I don't take any risks. I play it safe. I always case select. I focus on maximum predictability and safety, just because complications and failures, they do happen, but they're not good for business if you have too many of them. And lastly, when you have complications, when I have complications, I manage them swiftly, definitively, confidently. And I want the same for you, because complications will happen. And I want you to be able to manage them. So this training is important because you'll be able to place more implants. You'll be able to restore more implants. You'll increase your production. You'll build your reputation, offering more services in your practice. And that ultimately will make you grow, besides the joy and the fulfillment of doing great things, of doing great treatments. And this formula is already implemented by thousands of dentists, general dentists that can lift the sinus. We have some examples here. This is a lateral sinus lift window by Dr. Wirtz. Dr. Mendelovitz guiding me in sinus lifting, Dr. Desai, crestal sinus lift, Dr. Mark Link, wanting to do lateral sinus augmentation and actually doing it. So dentists are doing this type of procedure, but follow the exact formula, and that's very important. Don't create shortcuts or break the rules. You have to know the rules first before you can break them. So this is the agenda for tonight. First, we'll talk about how to find a simple sinus lift that you can do in your practice. I'll talk about how to avoid red flag cases that will make you not sleep at night and will create anxiety and are likely to fail. I'm going to talk about the instruments and materials. Very important, the consent for medical legal protection. Okay, you always want to be protected in this world. Then I'll talk about the step-by-step simple sinus lift formula, and also mention the different common mistakes dentists are making and how to avoid them. And then I'll talk about medications and the post-op instructions, because you need to give great post-op instructions to have great healing. So we have a packed presentation today reviewing the sinus lift formula. So my first tip right off the bat is don't take on every case. I don't. Not every case that needs sinus lifting that walks through my door, I accept. If there's a doubt that it's going to fail, if there's something that I feel is going to create a problem, and naturally I have more experience than a general dentist, but I also refuse some cases because my practice is a business, and as such, it needs to be successful and profitable, and we cannot afford too many failures. So I'm going to share with you how to pick those winner cases. I want you to pick cases that are safe, with low complication risk, and predictable. So when you perform the procedure, you go home, you don't think about the patient. You relax and you enjoy your time with your friends and your family, and you go to sleep and have a nice meal, not thinking about what could have gone wrong and dwelling on what you did wrong. How are we going to pick the right cases? We're going to start by screening our patients in 2D, just with periapical radiographs. I'd like you to start visually and on your screens, on your softwares, start identifying where the sinus floor is or where you think it is. Okay, we'll see what the difference between 2D and 3D is. Try to assess how much bone there is for an implant. And just as a very simple screening tool, look at the adjacent tooth. Look at the second molar. If this molar, you know the more or less the length of the adjacent roots, even if they're a tiny bit curved, you can tell that this case probably has enough bone. We'll do a 3D scan, obviously, but this is a very simple screening process. So trace your sinus floor wherever you think it is, and start to assess. Now, if the bone that you're seeing on a 2D is shorter than the adjacent teeth, this is an indication that this patient might need a sinus augmentation. Sometimes we are pleasantly surprised, not always. So we'll look at the 3D in a bit. But as you start training yourself to look at 2D x-rays, tracing the sinus, looking at how much bone there is and comparing it to the adjacent teeth, you'll get the notion if the patient needs a sinus augmentation. And sometimes it's quite obvious. There is very little bone for this case, and we know we need to do some lifting. So let's switch from 2D to 3D. You always start with the 2D. I find that in recent years, many dentists don't take 2Ds anymore. We got scanners and that's all. No, take the 2D. You're going to learn a lot more about the details of the case from 2D. This is my second tip for this training, and this is actually not a tip, it's a rule. There's no sinus lifting without a CT scan, period. There's no sinus lifting without a CT scan. Don't even think going into the sinus without having a 3D view. It's a legal liability. If something goes wrong, you're going to be at a disadvantage. You need to know the lay of the land before you do a surgery. So when you look at the 3D, you also need to understand what's buccal, what's palatal, obviously. The width of the ridge, we can see it quite clearly. We can identify the sinus floor. We can identify in the image where the outline of the restoration would be, and we can more or less see that we can place an implant in good bone, in good restorative placement, at least from a buccopalatal section. And I always look at the very simple things, and this is how I also show it to my patient. So if we move from 2D to 3D, it kind of looks okay now, but look at the 3D. In the 2D, it looked borderline, I don't need the sinus lift, but what I was seeing on the 2D is the buccal part of the bone, which is more cortical. So that cortical bone is going to present itself as good height. But if you look at 3D, actually, the amount of bone for an implant is surprisingly minimal. And we need a sinus lift in this case, okay? Because the implant is not going on the buccal bone. It's going more or less in the middle of the ridge. So keep this image in mind and don't get misled by 2D images and always take the 3D option. Remember that the floor of the sinus or the shape of the sinus does not follow the shape of the ridge. The ridge might be very, very square, but the sinus floor can dip in, actually dips in where the furcation used to be. So it's quite misleading to look at 2D, even at 3D, and not thinking that you need a sinus lift. All of a sudden, you find yourself inside the sinus. So how do we find a simple sinus lift that will not give us headaches and will not make us too nervous? You need to have at least 5 millimeter bone height on the CT scan. So you can lift and you can also have implant stability. Okay, I want to set you up for predictable cases. And you'll take a CT scan, you'll look at the cross section. If the bone height is 5 millimeters or more, then it's a great case for a sinus lift for you, and maybe even in a simultaneous implant placement. Because once you extract the tooth and you're looking at the 2D, look, the sinus floor is going to change. It's not going to be just straight, flat, corresponding to the ridge. It can be a tiny bit lower on the palatal. It can be a bit high on the buccal part of the ridge. So these are the variations between our different cases. So we need to be aware of that. Now, what do we do with eggshell sinuses? Yes, you can probably use the simple sinus lift formula for these big sinuses. We call them eggshell. We teach how to handle them differently with a different formula in our advanced training. But you can probably do it on less, but I want you to be successful and have less complications on your hands. So when you have cases where you have less than 5 millimeters, you know what? That's a case you can actually not do or refer them out. Or if you already mastered lateral sinus lifting or lateral window sinus lifting, that would be a great case for that. But it's not for what I'm going to be teaching you in this training. So bone height, a minimum of 5 millimeters. Next, look at the membrane. Measure the thickness of the membrane. And it's very easy to look at the CT scan. Look at the membrane. This membrane is about 1 millimeter. If you're seeing a membrane on the scan, it's usually about 1 millimeter. This membrane is a little bit inflamed. It's a bit engorged. It's thick. Maybe this patient has some sinusitis or history of an infection. It's about 3 to 4 millimeters, even better. And how about this case? Where's the membrane? I don't even see it. So that's where you don't see it. So if you want to find a simple sinus lift, you need to be able to see the membrane on the scan. If you don't see the membrane on the scan, it's not a good case for a simple sinus lift technique, which I'm going to share with you today. If you see it, you're going to have a lower risk of tearing. So your mission is to take that membrane and elevate it in an apical direction, place some bone graft underneath, and that's basically what we consider a sinus lift. And a membrane, the thicker, the better. Okay, and this is how you can you pick and choose cases that are ideal with 5 millimeters of residual bone with a thick membrane. You'll be able to accomplish and get results just like that and create those beautiful domes that we see with sinus lifting. And the word dome is going to come back again and again in this training. So how do we create that dome in the sinus? What's the principle? So the principle is that we're going to be drilling in the ridge all the way to the sinus floor. We'll create a small little channel. And through this channel, we're going to condense a bone graft. So the bone graft is what lifts the membrane inside the sinus. And the more we add bone graft, we are going to lift the membrane, and it's going to lift like a balloon. And that's why it looks like a dome. Okay, so that's very important to be to understand why a dome gets created, and it's also important to recognize it on a 2D X-ray. And if you have enough bone for initial stability or enough residual ridge, you can also place an implant immediately, and that saves the patient treatment time, saves the patient the surgery, but doesn't save them the cost, because you're going to charge them for the implant and the augmentation separately. Okay, so what do we need for a simple sinus augmentation? We need 3 items. We need bios. This is the bone graft of choice for sinus augmentation. We need a set of osteotomes, and we need a mallet. Okay, so what are these 3 items? So first of all, bios. Not a commercial for bios. I'm not a big fan of bios for different types of augmentation, such as ridge augmentation or socket grafts. But for sinus lifting, it's excellent. It's very radio opaque. It has great structural stability. It's centered. It's a great scaffold, and it comes in these particle sizes that, to me, are ideal. Plus, it's the most researched material in sinus lifting. Okay, there are thousands and thousands of studies using bios. So I've been using bios pretty consistently for over 20 years. If you have a different bone graft similar to bios, which is a xenograft, or you have something else that works for you, more power to you. I'm just sharing what I do in my practice. What do you mix it with? You can go with basics, mix it with saline. I like to mix it with PRF, and I also like to add some metronidazole. We're placing that bone graft in a very close space that is pretty well vascularized by the sinus membrane, but there could be some pocket of infection. So I'm adding some metronidazole to help combat some of those sinus pathogens. The second item we need is an osteotome. And the osteotome is the instrument with which we're going to condense that bone into the channel, with which we are going to push that bone graft into the sinus below the membrane to lift that membrane to create the dome. Now, my recommendation is, regardless of what implant design you're using, use cylindrical tips. There are certain tips that are more tapered, and I have that as well. The problem with the tapered osteotomes is when you use them, it condenses the bone so much that sometimes it doesn't allow the osteotome to advance. So I like to use the ones that are cylindrical. Plus, you want to have a kit that has the different diameters that correspond to the implants that you're planning to place, usually a wide diameter. When we're doing sinus lifting, we are replacing molars typically, or 90%. By the way, sinuses can progress all the way to the premolars, sometimes even to canines, but the majority of us sinuses stop short at the molars or the premolars. So you want to have a sinus lift kit with osteotomes that has all the different diameters, cylindrical, and with depth marks. So as you tap it in, you're going to start seeing how deep it goes. So you don't go too much, and it gives you a little bit more control. Okay. Second, these are straight, and so sometimes the rep is going to sell you a set of straight osteotomes, but don't buy the straight ones. Buy the ones that have an offset. Okay, it has an offset. Why an offset? What's the big deal? Why do you need that type of feature? Well, to my knowledge, the molars are in the back, and you don't have a direct line with a straight osteotome to that molar. So if you have an offset, the other end of the osteotome can be outside the mouth, where you can very carefully tap, and the offset is the way to go. Okay, so remember to buy osteotomes with an offset. Second, to tap on the osteotomes, you need to use a mallet. Now, the mallet, some people call it a hammer. I don't like that name. So it's a mallet. It's something you use and tap very, very gently. Got a bad reputation, okay, that you crack the sinus floor and you have to hit hard. No, don't do that. We are tapping in a very measured force. And if you need to tap hard, that means that you didn't do something according to the formula, which I'm going to still review with you. So you need to tap very, very gently, typically 2 at a time. And I recommend you get a mallet with a bumper, okay, that has a little plastic bumper. It dampens the tapping on the osteotomes, okay? So those three things are very important, okay? Important fact, important tip. The osteotome does not go into the sinus. It's the bone graft that lifts the membrane. This is actually a photo from an article or a book. I forgot where I got it from. And it shows clearly that the osteotome breaks the sinus floor and is in the sinus. No, don't do that, because this is a recipe for tearing the membrane and getting somebody injured, okay? The osteotome never goes into the sinus. It's the bone graft that lifts the membrane, okay? And I'll explain how this works, okay? So this is a no. Second, when you use a mallet, don't hit. It's not a hammer. You're not hammering nails. You're gently tapping on this osteotome, and you want to see feel that how it very carefully progresses. So now you know the 3 items that you need to have for sinus lifting: bios, osteotomes, and a mallet. And of course, you need a surgical kit and all that, but these are the 3 things you need for sinus lifting. So enough said, let's start lifting. Let's go over some cases. Let's talk about the simple sinus lift formula. There are 8 steps in that formula, and I'm going to review them, and then I'm going to review them again. Good education is by repetition, and I'm going to explain every step in that formula. Step number 1 in the simple sinus lift formula is to create a 2mm osteotomy to the sinus floor. Now, if you're using guided surgery, or you have some imaging or a positioning device, you can find the sinus floor. But most of us pre-measured where the sinus is. You drill with a 2mm twist. I call this step find the floor. And then step number 2 is you place a direction indicator and you take a verification periapical radiograph, or VPA. And you look at the actual direction indicator. You see if you reach the floor. If you're not at the floor, if you're 3 to 1 millimeters shy from the floor, no problem. Repeat step number 1. Take the direction indicator out, place your 2mm twist drill, drill an additional 1 or 2. When you get to the sinus floor, you're going to start feeling the change in density. You're going to start feeling that it changes from type 3 to type 2, type 1. Okay, that's you want to stop there. Okay, then you place a direction indicator, you take a second PA, and make sure that you found the floor. If you found the floor, great. We move to step number 3. Then, depending on your implant system, you continue with your drills at the same level. You found the floor at the level of the floor. You start widening the osteotomy to 4 millimeters. Okay, if there are multiple drills, great. Reach 4 millimeters, and then through that channel, you want to insert 2 scoops of a bone graft, of bios. Place your osteotome inside the osteotomy, and it's a 4 millimeter osteotome, and start tapping. If your osteotome, if you hear it like a knock, and it feels like it's not progressing, well, you're not at the floor yet. You might need to go back to a previous drill and drill a little bit more apical. I don't want you to break or fracture the sinus floor with the osteotome. This is what we were taught in the 90s, and that was okay for that time, and it led to a lot of complications. We want to thin out the sinus floor enough so with the osteotome, we don't have to break it. We gently tap it with the bone graft, so the bone graft will actually progress into the sinus below the sinus membrane. So step number 5, you condense and lift with a 4 millimeter osteotome, and then you place a direction indicator if you can. Take a verification PA, and by the way, if you're not through the floor, go back to step number 1, okay? But you should start seeing a dome creating. Even a tiny dome means you're on the right track, no problem. What you do now, if you see a dome, great. You repeat step number 5 until you reach your elevation goal, okay? So this is when you see the dome. What does it mean? It means that the sinus membrane is intact. And when it's intact, that means that I can keep adding bone and keep expanding that dome, not limitlessly, but we can start increasing the size of that dome. And if you have, and that's enough until you reach the desired elevation goal. And once you reach that, if you have 5 millimeters of bone height, place your implant. And for wide body implants, if the bone is not that dense, you under prep, which is that's why we use a 4 millimeter osteotome. And this is the simple sinus lift formula. Okay, let's. Oh, this is clear, and we're going to have some Q&A later. Let's go over a case that demonstrates very nicely how a simple sinus lift can be done. And all of you can do this type of sinus lifting. Here we see a hopeless molar with a vertical root fracture and a large infection. Do me a favor, don't lift at the time of an extraction. Is it possible? Yes. Can it be done? Yes. Have I done it? Yes. I'm never going to do this again. You want to lift healed sites only. So do me a favor, do your bone grafting, take the infected tooth out, clean out the infection, graft it nicely, regenerate as much as possible with the buccal bone missing. You can regenerate part of it as well until you have a healed site. So you are set up for success. Okay, don't put yourself at a disadvantage. Do your CT scan analysis. In this case, we have about 6 millimeters of height, maybe 5. So I have enough. I have a membrane that is nicely visualized on the CT scan, so it's at least 1 to 2 millimeters. I have a pretty wide ridge. I have great soft tissue. You see, I'm setting myself up for success because me too, I don't want to have any failures or any headaches or worries. Okay, there's enough worries on this world, as we know. We want to be in a predictable procedure, in a safe procedure with minimal risk of complications. So you do your analysis. Here we're seeing the analysis that the 6 millimeter would actually enter the sinus. So because we have so much soft tissue, we can use a flapless approach. You can do a sinus lift through a flapless approach as well. Here's our punch tool. And what's the first step? The first step of the simple sinus lift formula is to find the floor. So I take a verification PA. I'm still not at the floor. I need to drill a tiny bit more. Everybody can see my direction indicator here, about the millimeter shy of the floor. No problem. Take that indicator out, go back with your drill, and until you hit that sinus wall, you feel this change in bone density. Once you found the floor, now you want to widen to about 4 millimeters. Okay, 4 millimeters, because if you start lifting when the osteotomy is 2 millimeters, well, the osteotomes are not that small, and you have a higher risk of perforation and tearing of the membrane. So follow the formula, widen the osteotomy to 4 millimeters, and then you can start the lifting process. So we add 2 scoops of BIOS. This is our bone graft. It's mixed with PRF, in my case here. I condense it in. It's almost like doing a socket graft in some ways. Place the 4 millimeter osteotome. You see the offset is very clear and why we need an offset. And then very gently with 2 taps, and you need to look at the tip of the osteotome, and you need to make sure that those lines are slowly getting buried. Okay, if they're getting buried, we're doing great. That means that my bone is being pushed into the sinus under the membrane and starts to create that dome. Okay, so 2 taps at a time. Keep adding bone graft. Repeat that step multiple times until you reached the desired lifting goal. Okay, if you have already 5 millimeters, you don't need to lift it to 13. You can lift it to an 8. You can lift it to a 10. Okay, actually, lifting too much creates a more risk. You know, every balloon can pop at some point. Okay, so when you're lifting, when you're tapping that osteotome, look at the markings on the tool itself. Okay, study what those markings mean, how deep it is. Remember that I already said that you don't want the osteotome to be inside the sinus. So we are just tapping a tiny bit, adding more bone graft, tapping a little bit more, and starting to observe that dome. You see the dome is forming in here. And what else? I'm happy. What else do I need? I repeated that until the lift is completed, okay? My advice to you, don't overgraft. Don't get overzealous. Don't be too confident, because every balloon has its limits. It's going to pop. We don't want that. And you're not going to hear a pop, but it's going to pop, and all this bone is going to get dispersed in the sinus. We don't want that. So lift your 3 millimeters, 4 millimeters, and call it a day. This is more than enough. You can then place the implant, and it's done. The simple sinus lift formula in action. And every dentist can follow that formula. Simple enough. Okay, so this is what I call the implant opportunity. By knowing how to do sinus lifting, you are able to place more implants. You can treat your own patients. Don't have to send them out. You don't have to do a 3-unit bridge. And patients are very happy to be treated by you. They trust you. They like you. They want you to treat them. And now you have another skill to help them with that. Post-op instructions are not less important than the actual surgery, okay? You can be doing a great job, but if you don't get the right post-op instructions, your procedure can fail. So I wanted to review just the very important pointers for sinus lifting. You must give systemic antibiotics. If not allergic, I recommend Augmentin 875 twice a day. Start them a day before. Why not? If they're allergic, they can sometimes take Keflex, or they can take Cipro, they can take Z-Pak, but Augmentin is really a great antibiotics for sinuses. No exercise. No exercise. Yes, I know that our patients love to run and love to lift weights and swim. No swimming, especially with sinus lifting. They're going to start bleeding. That's one of the risks. They might have a nosebleed. I'm putting them on 600 milligrams of ibuprofen for the first day, and sometimes even the next day. So for about 2 days, they'll take ibuprofen, reduce some of the inflammation. And I also give them Sudafed over the counter, meaning that I recommend that they buy it from the pharmacy for 2 days or longer. If they feel a bit congested, why not take Sudafed for a little bit longer? And sinuses are obviously very delicate. So you must tell your patient, and on the instruction sheet, you must write in large font, no nose blowing. No nose blowing, because they're going to mess everything up. Okay, very, very important. Don't let them blow their nose. If they need to blow their nose, they can wipe their nose, do whatever they need, but not to blow their nose, because they mess things up. So, okay, no Louis Armstrong. We don't want anybody to blow their nose after a sinus lift. Okay, I can't emphasize this enough. So this is the essence of the post-op instructions. I also want you to be protected medico-legally. Okay, sinus lifting is maybe in the risk spectrum, is maybe higher risk compared to a simple extraction or simple implant, but not that bad. I still want you to be protected. So it starts by communication. I communicate with my patient about what I'm doing, and I'm actually showing them some schematics without scaring them. Basically, what you're doing, or what I'm telling my patients, is that I'm creating a small channel all the way to the sinus. And when I reach that sinus, I insert a type of a bone graft that lifts the membrane, and that's a sinus lift. That's all. Now, because we are moving the membrane, because we are operating in a closed space, there could be some side effects, and I want you to review them all with your patients. Number one, temporary transitory sinusitis is a possibility, okay? I want you to tell them, because they'll tell you what are the risks, what are the side effects. So most commonly, they might feel congested because you are lifting the membrane and you are creating some inflammation in the sinus. They might get a nosebleed on the corresponding nostril. If you did a sinus lift on the right sinus, they might get a nosebleed from the right nostril. Don't blow your nose. It might happen, okay? Some people have very delicate sinuses and very thin capillaries over there, and they might get a nosebleed. So just warn them for a day or two. Lastly, because we are moving the membrane and we are creating that dome, there is a possibility that the membrane will tear. And I just say it just the way it is, just like I said it right now. There is a possibility, even if I'm very gentle and very experienced, and now you as well, you know this, the simple sinus lift formula. The membrane can still tear. It can be scarred. It can be damaged. It can be torn in the first place. If it tears, you need to abort. Don't try any surgical acrobatics to try to fix or put some collagen in there, lift it in spite of it. When there's a tear, there's a tear, and you're going to have tears, and it's not, hopefully not going to be too much. You know, it happens occasionally. You see air coming through, you see a black hole, and there's no more resistance. When you do sinus lifting properly, according to the formula, you're going to feel some resistance as you push the bone upwards, okay? So talk about all these things, and they must sign a separate consent for sinus lifting. And the sinus lift consent talks about why they need a sinus lift, what if they don't get a sinus lift, what are the risks, what are the complications that can happen, the need to abort, nosebleeds, all of the above. Just protect yourself legally. And if a patient doesn't want to sign it, doesn't want to take those risks, then you just don't do it. It's not for everybody. Okay, so now let's do another case with 2 implants, same principle. Using the sinus lift formula. Again, here's the formula, those 8 steps. Take a screenshot because this is the most important part of the presentation. This is literally what I do in my practice, exactly to the T. Okay, this is just follow that. Don't improvise. Don't try to do things differently and invent your own ways and use different tools. There are different ways to lift the sinus. I'm showing you one way. I'm showing you what I think is a very simple way and a very predictable way and a very safe way that can save you a lot of troubles and heartaches and stress. Follow it to the T, those 8 steps. There's a very high chance that you're going to be successful. So bridges are going to fail. Bridges are going to fail. We know that. And when they fail, there's an opportunity to place 2 implants. Okay, this is the plan, but we don't have enough bone. Okay, so for those types of cases where you have an infection, where there's not enough bone, delay the placement, do the extraction, bone graft, let everything heal. A minimum of 2 to 3 months even. I sometimes even wait up to 3 to 4 months just to be safe. Why? Because I'm in no rush. Maybe the patient is in a rush, but I'm not in no rush because I want to set them up for success. And if I have a great ridge that healed, I have a great option to do my sinus lifting and place an implant immediately. So I do all my planning. Obviously, we need to do a sinus lift here. There's a mucus retention system. I'm going to talk about it a little bit later. But luckily, it's away from the implant site. I recognize it. I'm not going to get close to it, but I recognize it that it's there. Okay. This is an ideal case. We have over 5 millimeters of bone height. We have a membrane that I can see on the CT scan, and this is perfect for the simple sinus lift formula. Okay, I want you to start screening your patients for predictability and safety, the proper height of ridge, and a membrane that is visible. So what's the strategy here? This is our ridge. I'm going to actually create a full thickness flap, and I'm going to repeat the incision that I had when I did the extraction. You see like almost like a scar, so I'm going to follow that scar. So one of the principles we teach in our advanced training. And this is going to be a crestal incision slightly more to the palate, and I'm going to reflect the full thickness flap. So what's the step? What's the first step of the sinus lift formula? It's finding the floor. That's the initial osteotomy with a 2 millimeter drill. Well, here I'm obviously far away from the sinus. I have another probably 2 millimeters, so no problem. Take those direction indicators out, go back to your 2 millimeter twist drill, continue the same angulation, and keep drilling until you feel a consistency, the density of the bone is changing to very hard type 2, type 1, and then you know that you reach the sinus floor, okay? You always want to verify with periapical radiographs. I take probably an average of 8 to 10 x-rays during a sinus lift procedure for osteotome. Once you reach the floor, great. Now you start the widening. You widen to 4 millimeters, okay? Okay, so remember, we have to drill to the floor first, and only then we start the widening. Don't start lifting before you widen. That's a common mistake dentists are making, and now you know how to avoid it. And once you widened the osteotomy at the sinus floor level, now you can start the lifting process. And you lift it with an osteotome. You repeat that osteotome tapping as much as possible. You start to recognize a dome that is being formed right here above these implants. Obviously, we need more lifting for the molar implant compared to the premolar. The premolar probably needs about 1 millimeter. The molar needs about 3-4 millimeters. Repeat this process as needed until you reached your lifting goal. Don't lift more than that. What is this going to help you to have 15 millimeters of bone, 20 millimeters of bone? For what? Our implants are 10. They're 11. You don't need longer implants. Quite the opposite, okay? And because I have enough bone from a native bone from prior to the sinus lifting, I can now place my implants and get initial stability. And sometimes what I do before I place the implant, I add another scoop of bone so the implant itself is cushioned and is being pushed into the sinus with another spoon of bios. Okay, very, very simple. And this is the closure, primary closure. This is the few months later, the restoration, and this is the final case. So this is, again, an implant opportunity. You have the ability to perform sinus lifting. If you have that ability, if you have that knowledge and the clarity, you can do these types of cases. And I think you would agree that this is a very simple technique. Hence, it's called the simple sinus lift formula. Okay. Now, my tip to you is, as you're doing sinus lifts, I told you already that you need to take x-rays, but keep an eye on the dome or the domes. Don't be in la la land. Don't ignore that. I want you to visualize on the x-ray as you're doing the lift that you're seeing a dome. You see how these domes start to get created. You need to look carefully here, but you start seeing this semicircular structure, this protective dome, the iron dome around the implant. So you know what? You know that you did not damage the membrane. If the membrane would have been damaged, torn, or perforated, that dome would not be there. It would be crooked. It would not exist. You will see particles all over the sinus, okay? So keep an eye on those domes as they grow, and as they've grown enough because you made them grow, go ahead and place your implants. Now, there are a few cases or a few situations where I recommend you just refer them out. Don't touch them. They'll make you not sleep at night and create a lot of stress for you and medical legal liability. For example, sinus pathology. The sinus is infected with polyps and a lot of junk in it and all sorts of things. No, and besides, this case doesn't qualify because we don't have enough residual bone. But don't mess with these things. These sinuses are infected. Okay, you can see in the cross section that we have one sinus is completely obliterated. There's another sinus with septi, with separation inside the sinus. You can recognize this on a CT scan. You might do a lift and it might look great, but you're lifting only one part. You're not lifting this compartment here, and then when you place your implant, either now or later, it's going to be just empty in the sinus. It might even fall into the sinus. How can we manage that? Is there a way? Yes, there is a way, but I don't want you to go there. Okay, I do cases like that every once in a while if I have the motivation or energy, because I also don't want to have liability for myself. These cases are best managed with a direct sinus lift, with a window, which we teach in our advanced courses, okay? You can't do this with an osteotome, you shouldn't. So this is septi. Infected sinuses, okay? Right side, fully infected. Send them to an ENT. Well, maybe the ENT can treat the sinus first, do another scan, get the infection under control, get the membrane to be pretty thick. Why not? Do the sinus lifting, fine. But do your best not to treat these types of cases. Mucus retention cyst. Well, it looks like a pretty good case here for a sinus lift, simple sinus lift, right? Well, look at the scan. There's a mucus retention cyst sitting like an egg right above the ridge. So when I'm going to do my direct sinus lift or indirect sinus lift with an osteotome, I'm going to puncture that thing, or likely to puncture. Then you're going to have some yellow liquid coming out, some mucus. It's going to infect my bone graft. Is it possible to treat? Yes, it's possible to do. There's ways to treat these types of cases. I don't recommend you do them because we need to focus on the 90% that is very simple. Okay, 90% of all cases. Okay, here's it in a cross section. That mucus retention cyst. You're going to go in there, you're going to puncture it, and then you're going to get some yellow liquid coming out. And why? We don't want that. Okay. Now, can you place short implants and avoid sinus lifting altogether, like Bicon? Yes. Here's a case by Dr. Mendelovitz. There's a significant sinus pathology. He used the Bicon right to the sinus floor, and we know that Bicon works, even if they look ridiculously short. That's their forte, I guess. And I've done a few, and they work pretty well. Yeah, you can use these types of implants. And short implants do work well, but sometimes you don't even have 5 millimeters. You sometimes don't have even have 4. So sinus lifting skills are needed. Okay, so here's Dr. Mendelovitz, who has done actually the sinus lift that we're seeing right now, who was taught the proper planning to prevent poor performance. I know how to lift and place implants where I couldn't before. Doctors, to do sinus lifting is a game changer. You literally change the game in your practice. You double your implant opportunity. And now be aware that most cases can be done with a simple sinus lift formula. Sometimes you'll need to use a different formula with a lateral window. Yes, you'll need to know these types of procedures too. Don't start there. Start with the simple cases. And in this training, I showed you the criteria of how to pick your ideal cases. Can you avoid the sinus by tilting the implants? Yes, you can. You can avoid the sinus. We do have something called all-on-4, where we are tilting implants distally along the sinus borders. But it has to be an all-on-4 case. Don't compromise a restorative position or a restorative position or an ideal restorative placement because you don't know how to sinus lift. Okay, you can learn the skill to lift. What if you get an infection into the sinus and nosebleeds? Okay, if there's an infection, well, we have to make sure that the sinus graft did not get infected. The nosebleed will typically subside by itself. Following a window technique, how many months after do I place implants? Typically, we wait 4 to 5 months. So these are types of techniques that we are teaching in our advanced courses. We're going to talk about our implant course in just a minute. You need to know how to do the lifting, how to do suturing to create that level of bone and place your implants in a very precise, very accurate and safe way. So if you wanted to do this type of implant surgery with the simple sinus lift formula and other sinus lift formula, there is a roadmap that we outlined already in our training, in our surgical master courses. The first step, if you wanted to master implants, you need to know how to extract teeth and do bone grafting to get the ideal ridges for your implants. You need to be able to know the implant placement rules. You need to know how to graft cases in soft tissue, because soft tissue is not less important than bone. You need to know how to place an implant for initial stability. You need to know how to uncover. You need to have long-term follow-up and proper maintenance and dealing with complications and peri-implantitis. So I'm kind of outlining for you the key to success, or the roadmap. And for doctors that want to take their training to the next level and want to do implants at the next level, and if you enjoyed this training, you're going to love the Implant Blueprint Mentorship Program. This is our implant training, and we are opening registration today. We're going to answer some questions at the end. What is the Implant Blueprint Mentorship Program? It's a program. This is, first of all, it's our flagship program. We have already thousands of dentists that have taken that training. It's a training that gives you the confidence and the clarity and the precision to perform simple to advanced implant cases in your practice, if you're a GP or a specialist. And it's giving you the exact systems and protocols and blueprints for every implant case. So it's a very comprehensive program that will help you build a successful implant practice within a few months, okay? It's going to walk you through that roadmap I shared with you and help you succeed with implants. The program is excellent for doctors that are either beginners, the best time to start, also intermediate, and doctors that are advanced, because we all have knowledge gaps that we want to fill, and we want to see that we're doing things at the next level. And what I'm going to share with you in this training is how I do implants in my own practice, from the clarity to the precision to the confidence of doing implants. So this is how it works. So our program has 6 modules that go through that roadmap. There are bite-sized videos in each module. Literally, you can binge on them over a weekend, or you can watch them as you go. We also have monthly coaching, so you can prepare for your cases that are coming, review procedures that you've done. So every month we go live with all our mentees inside the training, inside the course, and we review all of their cases. So there are 6 modules. Module 1 is the extraction and bone grafting mastery. So you will learn how to do extractions of molars, central incisors, and do bone grafting so you can get the ridges that you want. And it includes everything from the extraction checklist, how we communicate with patients, how we execute that blueprint, molar extraction, central extraction, socket shielding, post-op instruction, and you're getting also live videos of all of these procedures. So you too can have cases like these. We have a lot of bone, a lot of soft tissue, and a great foundation for your implant. In module 2, you're learning how to place your implant in the ideal position. What's the ideal position for the implant? What are the basic implant rules? What software you need to use and how to use it? How to take records for getting the data for planning your implants. And then you learn how to plan lower molars and a central incisor. So you can plan implants even in the most narrow spaces. And it's a great module because a lot of us are doing implants and we don't really know what the rules are. Module 3 is about building soft tissue engineering for implants. How to create great soft tissue around implants, how to assess for that, how do I communicate this to our patient that just committed to an implant and an extraction, a bone graft, and an implant restoration, but did not commit to soft tissue grafting. How do we communicate this to our patient? And the step-by-step, and you're going to see everything also in high-resolution videos. So I'm going to share all these soft tissue grafting for implants and implant sites. Module 4 is step-by-step implant placement. It's the implant placement protocols, all the setup that you need, the consent forms, the financial arrangement, the sequence of the surgery, the torque algorithm to get predictable torque so implants don't start spinning around, the flap design using surgical guides, preparing the guides, the different drills and components and equipment that you need for the surgery, how to work with your assistant, and you're also going to see live implant surgery, including dealing with several complications. In module 5, it's taking that implant that we placed in the ideal position and transitioning to a restoration by doing aesthetic uncovering, and how to design the flap for aesthetic uncovering, how to check for integration, how to make a provisional, how to pre-make a provisional before you uncover it, how to index an implant, how to train the soft tissue, how to remove excess bone and tissue from your implant, and correcting implant malpositioning, dealing with narrow spaces. And lastly, module 6, you're going to learn the long-term maintenance for implants in your practice, so your implants are also successful in the long term, and you'll also learn how to deal with peri-implantitis. So maintenance protocols, the same protocols that I use in my own practice. Hygiene tools for implants, how to deal with implant infections, treating peri-implantitis, implant removal, long-term care, and follow-up. So this is the Implant Blueprint Mentorship Program. Our tuition typically on our website is $3,500. We're now offering it to you for a discount for $29.97, and you can join today for a little bit over $1,000 in a 3-payment plan. Registration is open. You can see the link on this page here. Our courses are always guaranteed. You can take the whole program, go through all the videos. If you didn't like it or it was not beneficial to you, you get a full refund. Simply send us an email. So we are fully guaranteed. Now, as you are starting to place implants, you're going to start seeing trends. And I already identified the trends and the typical cases that you're going to see in your practice. And I created a training that is called the Implant Practice Strategy, which is also a course with online tutorials that show you what are the most common implant cases that you see, from molars to centrals. It also teaches you how to read and analyze the CT scan for implants, how to do digital surgery, and this is this bonus is in itself $29.97. Okay, so you're getting it when you join the Implant Blueprint Mentorship Program. The second bonus, to be a great doctor, you need to have a great assistant. So we have an assistant training. It's called the Ultimate Surgical Assistant Training, called USA. And this is a program that you can review, but also with your assistant, and look at the surgical setup, how to assist in extraction, in grafting, in implant surgery, other different types of procedures. You're going to get the assistant tips. You're going to get huddle videos to watch before different procedures from an assistant perspective. And this bonus is $997. So you're getting it when you join the program. And you're also getting our monthly coaching, 1 year of monthly coaching, where you're getting 1 year of mentorship with us. You can submit up to 12 cases, for a monthly coaching. We have a system where you can submit them online. And then during the session, we review them. We give you guidance on the cases that you're planning to do and give you feedback on the cases that you've done. This is a very valuable part of the offering today, because you're getting mentorship. My goal in creating the program is not just to give you a bunch of videos and break your head and good luck to you. Is I want to follow through. I want to see how you're doing in the year from the moment you join the program, and you can always extend it for another year if you wanted to. And the doctors that succeed are the ones that participate in the coaching. Bonus number 4 is, you're going to have complications. So we are offering you as a bonus a complication management training. First of all, general complications, like we call it complication 911, how to manage the patient and how to communicate when complications happen. And then we have another training that is specifically for implant complications, mastering implant complications, how to deal with failures and explantation. This is when you have to remove an implant. So this is included in when you join the Implant Blueprint Mentorship. You're also going to get 36 AGD PACE CE credits. We have tons of doctors that have joined the Implant Blueprint Mentorship Program. You can read all of their stories on our website. So in summary, this is what you're getting. You're getting the online modules of the Implant Blueprint Mentorship, the IBM, a value of $3,500. You're getting the Implant Practice Strategy Program for $29.97. You're getting our Surgical Assistant Program, value of $997. Getting monthly coaching, which is the highest value, but it's the most important to be able to implement what you're learning in the training, you're getting the complication management, and that's a value of over $13,000. So today you can join for a one-time payment of $29.97 or a payment plan, and you can join today for a little bit over $1,000. You can join by going to the link on this page, implantcourse.com. Like all of our training, our courses are always guaranteed. If it didn't work out for you, you didn't get the value, or for whatever reason you thought, I wanted to do implants. Implants are not for me, actually. It's not a problem. Thank you for trying it out, and you're getting fully refunded. So we're removing any element of risk. So imagine if you take the Implant Blueprint Mentorship Program, and all you do is an extraction and a bone graft based on what you're learning in the training. And then you place an implant, then you do an implant restoration. Well, a lot of the dentists, and this is the lower molar scenario. This is the most common scenario in the mouth. This is what you can do almost every day. You're going to get a tremendous ROI on your investment in the course for $29.97 or $1,000 a month for 3 months. You're going to get a tremendous ROI. This is Dr. Acosta. We're quoting him. He increased his production by 200%. It's not a guarantee, not an earning guarantee. That's could be very individual to Dr. Acosta, but it is possible to build your practice. And why wouldn't you? If you're doing implants, if you're doing more bone grafting, if you're doing them at a top level of confidence and predictability and safety and precision, well, you're going to grow your practice. Go to source for surgical training. You can read all of those testimonials on our website. If you go to the link here on this page. If you join today, you're getting bonus number 5, which is a special training on how to present and sell implant surgery. So yeah, we have to promote ourselves. We have to know how to communicate, and you can do implants at a very high level. But if you don't know how to communicate it and you're getting low case acceptance, what's the point? In this training, I'm going to share how I present and sell implant surgery to my patients. It pretty much sells itself, but I have a system, and I'm going to share this system with you. So you're getting this training when you join the Implant Blueprint Mentorship Program. So this is the summary of the offer today. Getting the Implant Blueprint Mentorship Program, the Implant Practice Strategy Program, the Surgical Assisting Program, the monthly coaching, complication management program, and how to present and sell implant surgery training. The value is close to $14,000. Amazing. We are offering you all of that at a very high discount for the tuition for all of that for $29.97, or you can start today for $1,097 in our payment plan. Go to this link here, read about the course, read the testimonials. It's pretty elaborate. There's a lot of information about this course. I hope you enjoyed this presentation. I hope you enjoyed learning about the simple sinus lift formula. I hope it benefited you. And if you wanted to take your implant surgeries to the next level, join us at the Implant Blueprint Mentorship Program.